So much better than it used to be. And we're
Hmm.
talking about this traditional versus custom and where we are now. So
Yeah, yeah.
if you think about that surgery, traditionally it's an 8 hour operation. People are wired shut. Their mouths and soft tissues are stretched for 8 hours, you know? And it's the stretching that causes so much of an inflammatory process. And 8 hours of stretching is very traumatic to the tissues. And then you wire the mouth shut. There's no question that that was a rough recovery and still is for a lot of patients. Now, if we can take that down to a 1 hour operation or 1.5 hour operation, which is the way I can do it now, and limit the amount of stretching and trauma to the patient, and then also not have to wire them shut, get them into a position that's more passive, not fighting, I don't have to make it up for you to understand that it's going to be a better recovery, right? And I've
Yeah.
seen that happen. So most of my patients stay one night and are ready to go the next morning.
Wow.
And recently, if my morning cases, I'll even send them home the same day, and they'll do great. The patient I had today, she said she had zero pain in her recovery, or 0 to 2 pain in her recovery. And that's not the norm. Most people will have some pain, but I would say the majority of the patients that I'm treating will take Tylenol and ibuprofen with some type of narcotic for breakthrough in the first week. After 1 week, most of them are off the narcotic and are taking Tylenol and ibuprofen as needed. And after 2 weeks, the majority of my patients are off pain medicine and very comfortable and back
Wow.
at work.
Back at work, so they're not looking like zombies 2 weeks
No,
later.
they're 2 weeks. Most of them, almost all of them, are back at work. Now there are exceptions, and everybody's a little different. But I would say a good 80 to 90% of them after 2 weeks are ready to be at work.
Yeah, yeah. Generally, I find with surgery, the healthier you are, and the better your lifestyle, the faster you heal. Obviously, there's going
For
to be
sure.
some people that abuse themselves, that are
Yeah,
whatever, overweight, diabetic, so on and so forth. They're
correct.
gonna they're gonna be swollen longer,
Yeah,
But
yeah.
if you're healthy, you'll probably heal pretty quick.
It's very true. And then the other thing, which is something that I've witnessed and completely believe because I've seen this happen, positivity makes a huge, huge difference in recovery. Patients that have an optimistic belief about how they're going to do after surgery and a positive tendency do physiologically better than
Totally.
people that don't. And it's really amazing, but the cells listen when you speak. And as an MD, it may be crazy for someone to hear that, but this is proven true, and I see it all the time.
No, that's amazing. I totally buy that. I think that pain in the body, there's so much about them that's mental, and that makes things complicated. But you can definitely use that to your advantage and
Absolutely.
work that in your favor. I'm a
Yep.
big proponent of fasting after surgery, at least for 3 days or so, to just give your body an opportunity to do nothing but heal.
Yep.
That's what I've done with the surgeries I've had, and I've gotten great benefit from it. So I think if people are scared of doing surgery because of the recovery, there's a lot that you have control over with that.
Absolutely. For
That's the
sure.
message I want to put out there.
Yeah, I agree with you 100%. And I think, if you talk to my patients that have gone through this, most of them will tell you it is not at all as bad as they expected. And they'll all tell you they do it again.